A few years ago, I was diagnosed with polycystic ovary syndrome, and the doctors who treated me wanted to treat me as if I was a cisgendered woman who wanted to have kids, and didn't really take into account that that's not necessarily the way I identified or what I wanted.
Early on, after coming out, I had a negative experience, actually during my first pap smear. In the middle of it, started asking me questions about my sexuality, and then giving me quite a lecture about morals and about what was right and wrong to do with sex, and about letting down my parents, all in the middle of the procedure, which was a really sort of traumatic experience.
Just after I was received my positive diagnosis for HIV, I sought the services of a clinic in Melbourne. Basically, the assumption was made that I was just looking for a good night, and basically made the choice of having unprotected sex, when actually the case was I was sexually assaulted, and that's how I contracted HIV.
When I came out, I had a lot of issues with my family and them accepting that, which led to a few years being estranged with my mother in particular. And to rebuild that relationship, we had a few mediated sessions with a therapist, and those sessions became about how I'd left my mother in the dark and how I'd done wrong by her.
I ended up in an adult psychiatric ward where the doctors all refused to acknowledge me as trans and used the wrong pronouns, like, deliberately.
I've never had a good experience in healthcare.
It made me feel like I couldn't trust doctors. It made me feel like I had to very much bury who I am and just pretend to be normal, I guess.
This experience made me feel really vulnerable and not safe in my vulnerability. Yeah.
This experience made me feel dehumanised. It made me feel like I wasn't worth as much as other patients.
I've had one really good experience with a neurologist that I saw. She noticed that I'd ticked Mr. on the box, but my doctor had put the referral as female. And so she actually spoke to me sort of briefly about that and just asked what pronouns I'd prefer. And when she then had to write a letter again, she checked what I wanted to actually have on it, and that was fantastic.
I had a good experience with a GP who wasn't fazed in any way, you know, didn't blink, didn't act uncomfortable or awkward as soon as I mentioned my partner. And from the beginning, I felt that she understood that I was in a same-sex relationship, that it wasn't particularly relevant to the issue that I'd come there for, but if it did come up, it was something that could come up very easily and comfortably.
Come across a dental practice and they're really caring. They know I have HIV, and they're just very gentle and very considerate.
My message to healthcare providers would be to take the time to really learn about and become comfortable around issues relating to sexual diversity and gender diversity.
If it's out there and we know that people are actually investigating and finding the information and they actually understand, that shows that understanding of that, we can actually stop being so prejudiced ourselves and maybe try to find that help.
LGBTI people do go through more issues because we do have to deal with mental health at a higher rate than our heterosexual counterparts.
My message to healthcare providers would be just listen to your patients. If they say that they're trans or they prefer certain pronouns, it doesn't really affect you as a doctor. Just use the pronouns they ask.
It starts with just a dialogue, communicating and not expecting it to be listed on a piece of paper. It's very important that we have a communication that's one-to-one and that someone is actually listening to what we're saying.